With the opening of this unit, we actually are more than 50% ICU beds. There's not another children's hospital like us anywhere in the country. There's so many reasons for you to be proud of this, I think, particularly landmark day.
The hospital was really in need of additional critical care beds. In addition to adding more bed capacity, they wanted to create a contemporary critical care unit capable of meeting the needs of the children clinically as well as the psychological and emotional needs of the patients and the families and the staff.
The rooms are all private with 3 discrete zones for caregiver, patient, and family.
For the family member, for the parent, we have pull-out sofas, there's a patient fridge, lockable security.
Separate TV that they can listen to with headphones.
Just to give them that knowing that they can stay there with the child and take care of them while they're in need.
Did they have opportunity? Could they be present but not necessarily be in the way if there was clinical care that needed to be provided? But they always wanted to make sure that the family, was available and would understand what was happening.
They feel like they're a true collaborator within this overall zone.
We created charting alcoves at every patient room. Not only is it a charting station, but it also has viewing windows into the patient room.
We wanted to make sure that from each substation there was visibility of 2 patients. Sometimes staff work one-to-one, but sometimes they're having to be able to visualize 2 patients, so we had to make sure that there was adequate sightline.
There's a sense of security for the patient, but there's also privacy if needed.
We spent a lot of time studying the patient room. There's a very complicated head wall that has many quantities of medical gases and electrical outlets, and there's monitors on the head wall, and there's data ports for different types of equipment to be able to plug in. So we spent a lot of time on the configuration of the head wall. There are families of different cultures and different needs on the unit. At CHONY there's a lot of Orthodox Jewish population, so we had conversations about how certain hand-washing sinks would meet Shabbat needs in terms of the way that they practice.
Every patient room has large windows to kind of give that openness and that light in those rooms.
All the rooms and even the consultation rooms had data jacks for translator phones in case there's language barriers.
New York Presbyterian is very close to their standards. They want to make sure that they are always being innovative, using the right material at the right time, making sure that we don't design just for design, that we're designing for the patient and for the family and also for the nurses. I think their staff spend a great deal taking great care of these children and to make sure that we have a great environment that makes them want to be there every day.